those needs addressing. Now, once we've ruled all that out and we know that yes, the joint is pretty healthy, pretty straight, there's nothing structurally wrong with it, but the initial X-rays, MRI scans have shown some early degeneration or early arthritis, those are really the right patients for this kind of biological therapy. So we give them the stem cells, which is the cellular element for healing, so the cells can differentiate into the cartilage that we want them to. We add in the PRP that creates the environment for it to work in, so the growth factors and the cytokines we've seen, which are very important. And lastly, we replenish the joint fluid with the viscosupplementation, because that gives you that protective effect. So once the healing has happened, what you don't want is to lose that. So if you have a little bit of cushioning and the viscosupplementation to add on to it, that helps with regards to moving forward. Now, the other two things which I think are very important are paraclinical factors that I think make a big difference. And one is a nutrition and dietitian advice and support, and we're starting to get that into our patients in the combination therapy. So basically they get a good session with the dietitian on what they should be eating for good joint health, what is the right foods, if they are overweight, weight loss programs, because we know from evidence that helps and that works. And lastly is the physiotherapy. Now that is again vitally important, as that sort of ties everything else in, with muscle strengthening exercises to basically help take the load off the joint. There's enough evidence being published to say that that works and it works well. So we're trying to use a combination therapy approach really for all of this. Now, hip, knee, ankle, but also being more commonly used in smaller joints as well. Isolated cartilage defects, again, it's because of injuries that younger people sustain and these cartilage lesions don't heal. So those are the kind of patients that need something further doing. Tendons, so tendinopathy is a big conundrum. It's been in there, being used, I think, in clinical practice for over 5-7 years, but we're starting to see over the last 2 years more and more results and data coming out of it, which I'll share with you. And lastly, as Attar mentioned, is viscosupplementation. So again, we'll tie all that in. So firstly, let's start off with the platelet-rich plasma. So how does it work? So in your blood, you obviously have platelets. Now these contain a lot of growth factors and cytokines, which are very important in healing pathways, in healing of any injury, any joint, any arthritis. So what we're trying to do with the PRP is trying to concentrate that area of the platelets and inject it back into the area that's a problematic area, to basically allow the body itself to start healing, but giving it a bit of a boost. So we're using your own blood, concentrating all the healing factors, injecting it back into an area, which would eventually probably heal, but it'll probably take longer. So all we're doing with this is we're trying to speed up the healing, trying to enhance the healing as we move along. So mainly the growth factor phase with the growth factors from the platelets will work or start working from a phase where straight after the injury, go all the way up to probably half of the proliferation phase. That's the most key area. So if you can get an early injury, an acute phase injury in that area, and you inject PRP into it, then you're just trying to maximize the healing potential of it. And again, how does it work? Basically it works for chemotaxis, so it attracts all the right cells to the area that need to be there. Cell differentiation, so if there's a certain cell type that's lacking, that's required in the healing, again you can differentiate that and it helps do that. It increases the cell proliferation, so it gives you more number of cells in a smaller area, again which enhances and improves healing. And angiogenesis, so it opens up sort of blood channels into areas, especially in tendons. This is very important because sometimes you get a lot of scar tissue and the scar tissue stops all the healing factors getting in. So what this does is it opens up some blood channels, allowing more good healing nutrient factors to come in to support the healing. So growth factors are very important. What about in osteoarthritis? Now osteoarthritis is sort of a vicious cycle. If someone has a little bit of osteoarthritis, a bit of damage in cartilage, natural reaction is they avoid using that joint to protect it. That causes more degradation in the joint. Further degradation in the joint causes a little bit more increased weight loading in the subchondral bone, which is the area just below the cartilage. So that gets thicker, they get more pain from that. The joint gets a little bit more inflamed. You get a lot of pro-inflammatory factors floating around in the synovial fluid, which further injure the cartilage, cause a lot more inflammation and pain. So they end up in this vicious cycle, and then they don't load that joint again. So what PRP does is it pretty much breaks that cycle down. So it increases the chondrocyte proliferation.